Our topic today is ICD-10-PCS coding for vascular procedures, a challenging and complex topic for many coders. I'm your presenter, Lynn Kuehn. Our cardiovascular subject for today is coronary artery bifurcations. Let's start with the question, what is a bifurcation? Webster says that a bifurcation is the point or area at which something divides into two branches or parts, or the point at which bifurcating occurs. Think of this as the fork in the road. The bifurcation qualifier indicates that the lesion is at the point where the bifurcation takes place into two vessels. When coding angioplasty of coronary artery lesions at the bifurcation, the body part value is the number of arteries treated, and the qualifier value is 6 bifurcation. If stents are left in place after the dilation procedure, we code all of the stents used to treat the lesion at the bifurcation in the device value. Where are these bifurcations located is probably your next question. Here is a list of the most common bifurcation spots. This list gives you the names of the arteries as they branch. There are others, but they are very small and not often involved in the procedures. In addition, not all patients have this exact coronary artery configuration. There are variations. An image of this might be even more helpful. I've numbered the major bifurcations on this drawing of the anterior side of the heart. This is one of the images included in the Vascular Roadmap flashcards from Libman Education. The right coronary artery branches off into two branches, the right marginal and the right posterior descending. Number 1 shows the branching to the right marginal, and number 2 shows the branching to the right posterior descending, which takes place behind the heart. Next, the left coronary, which is also called the left main coronary, then branches into two branches, each that do some branching of their own. Number 3 is the left main coronary branching into the left anterior descending that comes down the middle of the left side of the heart and into the left circumflex that goes around the bottom of the left atrium. Number 4 is the left anterior descending branching into the diagonal artery. The last one, number 5, is the circumflex branching into the obtuse marginal artery. Number 3 is where the left main coronary branches into two separate arteries and is the only location in the coronary arteries where 3 arteries can be treated simultaneously. There are excerpts here from the 027 table for dilation and 02C table for extirpation, the only 2 tables where the bifurcation qualifier is found in ICD-10-PCS. Just to review, the number of arteries treated at the bifurcation is identified in the body part value, and the qualifier value is 6 bifurcation in either of these tables. In the 027 table, the number of stents used to treat the bifurcating arteries is captured in the device value. Let me give you an example of the coding. I'm going to use bifurcation number 4 from the heart image. This is a lesion that starts in the left anterior descending and extends into the diagonal branch. And this might be exactly what the physician documents. They are not required to document the word bifurcation. That's why we need to know our anatomy and recognize what the documentation is telling us. In our example, the interventionalist treats this lesion with 2 drug-eluting stents, probably one in the long left anterior descending and another one in the branch called the diagonal. We're going to use the rules for determining coronary artery body parts. We have 2 distinct arteries that were treated at this bifurcation. The root operation is dilation. The code is going to be 0271356. The code tells us that this is dilation of 2 coronary arteries at the bifurcation with 2 drug-eluting intraluminal devices, and this is a percutaneous procedure. All of the information about this procedure is captured in one code. I hope the image and my explanation has been helpful. The Vascular Roadmap flashcards are available from Libman Education at this URL.